Today I've presented on patient safety of oral chemotherapy outside of cancer centres. So I've looked at two issues. One is adherence with taking the oral anti-cancer medicines, and the second is to do with patient reporting of symptoms. So the first part of my talk looked at adherence with taking oral chemotherapy, and what I was able to show was that more patients than we think don't take 100% of their prescription for oral chemotherapy, and there are lots of reasons for that, and some of those can be around patient beliefs or experience of taking the drug. So for example, if someone has toxicities or side effects that they don't like and they don't believe the drug's helping, they may choose not to take that drug, and we need to have open and honest conversations with patients about their attitudes towards their medicines and ask them if they are taking the medicines, and if not, understanding why that is. So some of the other things that we know that can help patients with adherence to oral chemotherapy are things like reminder devices, patient diaries where they can tick off when they've taken a dose, and the counselling that actually engages with patients and gets patients to talk about things like their routine and how they'd fit that oral medication within their routine. The second part of the talk was around reporting of symptoms, and that's something that really interests me, and we know that patients delay reporting their symptoms for all types of chemotherapy, including oral drugs, and there are lots of reasons for that. Some of that is around patients not understanding how bad a symptom should be to call us. Some of that's about them not wanting to bother us, thinking we're too busy to approach and maybe their symptoms aren't serious enough, and actually we want them to report them earlier. And there are some riskier people who maybe are older or have comorbidities who are at greater risk, or where people are depressed. So depressed patient is less engaged in their treatment, so maybe less likely to report their symptoms. So some of the things we can do around empowerment are giving patients things like traffic light tools which help them work out which symptoms to report urgently. And there's also a very nice study going on at the moment about a handheld device, so that's the ESMO study. It's a European study, and patients will put their symptoms into a device, and that would trigger us to call the patient if required, or it would give patients self-management advice which would empower them as well to manage their treatment.